let's put some of that to the Health Secretary, should we? Wes Streeting, hi, it's good to see you.
Good morning.
Thanks for taking the time. The report by Lord Darzi says the NHS is in a critical condition. How are you going to fix it?
Three big shifts fundamentally. A shift from a hospital to community. So we get to people earlier, diagnose faster, better for them, better for taxpayers. A shift from analogue to digital so that patients can use health services and care services with the same ease and convenience we can elsewhere in our lives, and crucially giving staff the tools to do the job so that we tackle that productivity challenge that you've seen on the front pages. And thirdly, deal with the sickness in our society that sees people living longer but becoming sicker earlier, worse for them and more expensive to deal with. And that's why today's report was so important, because ironically, although it's looking back on how we got here and diagnosing the illness, it's actually helping us to look forward and be honest about how we got here. We got here because of a decade of underinvestment, particularly on technology, where we're 15 years behind the private sector. We got here because of the disastrous top-down reorganisation, a political disaster, where the consequences are still being felt. Pandemic pressures, of course, but what shocked me is that we were far worse hit by the pandemic in terms of cancellations of operation and procedures because of what led up to the pandemic, not just failing to fix the roof while the sun was shining, but effectively pouring petrol on the house, turning the gas on, and then the pandemic lit the match. And then finally, sort of getting to a point where, because we've failed to deal with illness and disease in our society, we just see the costs ratcheting up, and worse still, the money being spent with poor outcomes. So we've had record numbers of staff going in since 2019, and yet productivity's fallen, which is why I say, and I've said this in opposition too, it's not just about more money, it's about where the money goes.
Okay.
So it's investment and reform, crucially.
I'm a bit baffled how a report of such magnitude can be compiled and completed in 9 weeks. How detailed can it be?
It really is, and the proof of the pudding's in the eating. Over 300 data sets, huge engagement in the consultation, an expert reference group. To be honest, Kate, I've drawn a different conclusion. If we can do a thorough piece of work like this in 8 weeks, why is Whitehall so often slow on so many other agendas? I don't know exactly how many hospitals Lord Darzi, but bear in mind...
Who did he talk to?
He spoke to frontline staff, he spoke to leaders, think tanks. I gave him unfettered access to data in both the department and also NHS England. And, well, no, it's an independent. He's a Labour peer. He's a Labour peer.
Well,
he's an independent peer at the moment. He's served both Labour and Conservative-led governments. And the reason we picked Lord Darzi, he's got over 30 years of experience as a surgeon. He's been a minister. He still serves on the front line.
The political equivalent of an all-night essay crisis.
No, I haven't done quite a few all-night essay crises, let me tell you. His report is a lot better than any of the essays that I wrote as an undergraduate.
I think a report of this magnitude that you say will shape the NHS going forward for a decade. You can't put that together in 8 weeks.
I strongly disagree. Actually, it's a reminder that we've got to go a lot faster in government.
Why was Wales not included?
I'm responsible as the Secretary of State for Health and Social Care, primarily for the English NHS, but I can tell you I'm working with the Welsh Labour government, I'm working with the government in Northern Ireland, and despite our political differences on the future of the United Kingdom, I have a good relationship with my counterpart in Scotland as well. But we are actually at the moment, both myself as the Secretary of State here in London, working with the Welsh Government on what we can learn from them, but also what they can learn from us and how we can work together in stronger partnership. Because I want to create a rising tide that lifts all ships across the United Kingdom.
Let's talk about this report, if we may. As you say, it doesn't include the Wales NHS. I mean, it's apocalyptic language put together by a Labour peer, despite what you say. You say it's independent. You didn't have any involvement with it. Just talk me through how he put it together.
Thorough research. We gave him unfettered access to the data sets at both the Department of Health and Social Care and NHS England. He was allowed to ask for whatever he wants and got whatever he wanted. He's had a really good team doing the data analytics and coming up with a robust and, I think, unarguable evidence base. He has done genuine engagement with people on the front line as well as leaders. He's had an expert reference group. And I really do think And I think this is a challenge for the way that government works. If we can do a report of this quality in 8 weeks, it is a reminder that too often Whitehall is sluggish and slow, and if we haven't got time to waste. And this Labour government has hit the ground running in the last 9 weeks, not just, in my case, commissioning this report, but resolving the junior doctors' dispute,
I remember Tony
dealing
Blair.
with GP
I remember
unemployment.
Tony Blair saying exactly this. I'm old enough to remember him compiling a similar report. And look where we are.
Well, and Tony Blair delivered the shortest waiting times and the highest patient satisfaction in the history of the NHS. And what's criminal is that in the last 14 years, the Conservatives took that golden inheritance and squandered it, and they don't bear any responsibility.
Well, we'll see. The Shadow Health Secretary is coming on.
Well, and ask her if she agrees the NHS
Don't tell me what to ask her.
But ask her if the NHS is broken, and ask her if she'll take any responsibility for it. Because it's been a running theme of the last 9 weeks. They don't take responsibility for anything they've done.
How's the government going to pay for this large-scale overhaul?
Well, it's about investment, sure, and it's about reform. I'm working with the Chancellor ahead of the spending review to make sure that any additional resources that go in are linked to reform, that we improve the productivity of the system and don't do as the Conservatives did, which is just pour more money into a broken model and fail to reform. That is where, why we are where we are. And in fact, even Robert Jenrick, Victoria Atkins' preferred candidate for the Conservative leadership, has accepted the Conservatives that haven't reformed and were scared of reform, and that's why only Labour can be trusted to reform
Given the dire
NHS.
straits that the NHS is in, should you really be nicking money off pensioners?
I think because we've got a £22 billion black hole and we've had to make and will continue to make really difficult choices. Well, no, Kay, because if you take the junior doctors dispute,
I'm not going to let you take me away from the fact that the pensioners, you're taking 300 quid off pensioners. As a result, a report that you compiled yourself says 4,000 unnecessary deaths if you took money off pensioners.
There's a £22 billion black hole. The cuts to the winter fuel allowance and the means testing of it will save £1.5 billion. There's still more to go, and I'm afraid more hard choices still to come. Pensioners will still be better off this winter than they were last winter, and will be better off next winter further still, because we made a political choice to stick to the winter fuel, to stick to the triple lock, to make sure that in terms of this winter, the Warms Homes discount is there. We don't normally do impact assessments day to day. There will be impact assessment on all of the fiscal decisions around the budget and the spending review. Well, the Conservatives know full well that we don't normally do impact assessments on every policy decision day to day. There is going to be an impact assessment on all of the budget and spending review. On the budget and the spending review, there'll be a impact assessment that takes into account the cumulative decisions the Chancellor makes. And we've got fairness at the heart of what we are doing. And as I say, I know it's hard. And, if I think about the sickness in our society, the sickness in the NHS and the sickness in the public finances, the medicine doesn't always taste good, but it's a damn sight better than the alternative. And that's why we are making difficult choices.
How did you feel? I mean, did you just hold your nose when you voted in favour of taking this money, or the vote that was held in Parliament, that you thought it was OK to take money from pensioners? How do you sleep at night knowing that that's what you've agreed to?
How do I feel? I feel really angry that we've walked into a situation with a £22 billion black hole, where our predecessors had spent the National Reserve 3 times over in an act of profligacy and waste unprecedented outside of a crisis like the pandemic. I think they should be ashamed of themselves. And we are now cleaning up their mess. That's hard. The medicine is hard to swallow. But as I say, if we don't take the tough choices now...
You. Did you see that?
Well, but she won't take any responsibility when she comes on, because they never do. They sit there carping and criticising now in opposition. Not once has any of them stood up and said sorry. Any of the Conservative leadership candidates want to say sorry?
No,
they won't. I mean, Kate, it's not deflection. It's about responsibility. It is outrageous. £22 billion black hole. It's outrageous. It's outrageous what they did to our public finances. It's outrageous the state of the NHS. It's outrageous the state of the prison system. It's outrageous the lawlessness on our streets.
How did you feel about that, seeing prisoners celebrating as they were coming out with bubbles?
It is outrageous, but it's outrageous for any Prime Minister...
But it's actions that you're taking.
No, it's actions that the Prime Minister, before the general election, should have taken when he was warned by police chiefs, by prison chiefs.
If you knew
that unless he acted, we would end up in this crisis. Why wasn't it? Well, because we did not know. And the OBR accepts this, the IFS accepts
does not accept it.
But we did not know there was a £22 billion black hole this year in day-to-day spending created by their waste their profligacy and their recklessness, deliberately spending money they knew wasn't there on the hope it would carry them through the general election, save a few more seats, and someone else would pick up the responsibility for cleaning up their mess. That's what we are doing now.
If you didn't know,
we
you
will
should have
face
known.
up to the hard
If you
choices,
didn't know,
and we
you
will
should
not
have known.
duck the difficult
You should have
decisions.
known.
No,
You
Kay,
certainly know-
that's
you
not a
certainly
fair
know there's a
criticism.
scandal with the post office.
We knew
you
there were-
certainly know that they still haven't received their money. You certainly know that Mr Bates still has only been offered 30% of what he lost. What are you going to do about it?
Well, that's not for me to announce, that's for my colleagues. But you're right to say...
No, you're representing the government this morning.
You're right to say,
What
as I
should
say,
happen?
as I say, it's not for me to announce, it's for colleagues in government to announce, and I'm not.
So you're going to do something about it? Given that
I'm
you
not
can
gonna
put together an NHS report in 8 weeks, I'm sure you can sort this
Well,
out.
I'm not going to trample on other colleagues' turf, but what I will say, Kay, is that we did know coming into government that the economy was in a dire state, the public finance were in a dire state. That's why in our manifesto we made promises we could keep, and we will deliver promises the country could afford, and we showed how we would pay for them. You'll see that in the budget, you'll see it in the spending review too.
I get in
but
trouble for keeping
we make
you too
no
long.
apologies for cleaning up the mess the Conservatives
Just to
left.
clarify, Lord Darcy was elected as a Labour peer, is that right?
And served in a Conservative-led government too. He's an independent peer at the moment.
And why is he an independent peer? Because he didn't want to work with Jeremy Corbyn.
Absolutely.
There you go. Thanks very much indeed.
And neither did I, but
Thank
we
you
dealt
very
with
much.
him, didn't
There
we?
we go.